All right, we do have a Fox 35 health alert this morning. How about this? No scalpel, no sutures, no incisions. Yeah, it's new relief for people who are losing some of their hair, like me. When I look like this sometimes, Doc, I think I got a problem here. Maybe we can talk after the show. Joining me now to talk about the NeoGraft is Dr. Roger Basson, plastic surgeon. Good to see you once again.
How are you?
And also Ron Doria, NeoGraft patient. Good to see you down there.
See you.
Let's start with you, Ron. Why did you decide, all right, I need to get something done here?
It was, for me, I lost my hair in a very strange way from a car accident. And I didn't want to be bald anymore. So I started doing research and research and research. And the technology today, I figured if I can have a full head of hair, and it's only going to take me one day to do it, it was a no-brainer for me. So
you got a full head of hair now.
I've got a full head of hair
but we do
now.
have some before pictures, so
Yes.
let's take a look at those here very quickly and see. So, okay, it was just going, but man, completely different.
Crazy, right?
All right, when you look back at that picture right there, what do you think?
A guy that felt good on the inside and looked bad on the outside.
Did it make you feel older?
Yeah, I mean, I exercise, I stay fit all the time, but when you don't look as good as you feel, there's something that is missing. There was one piece of the puzzle that was missing. And when I would go out to a dinner or something, I would never sit under a bright light. I always sat in the back a little bit, always wore a baseball cap. The confidence was not there. My confidence is back tenfold now.
Oh, that's
so
cool.
It's
yeah,
good.
It looks great. Now, doctor, I'm sure you hear this a lot. Not just men, women also facing this. What's new about this NeoGraft procedure?
Well, I mean, bottom line is that there's no cutting and no scarring.
I didn't realize how you used to do these. You were just showing me the scalpel there. You took parts out of people's scalp, more or less, in transplant.
Yeah, what we would do, we'd take a very sharp instrument, such as this scalpel over here, and what we would do is we would actually, if you want to come in tight over here and take a look at the scalpel, what we would actually do is we would take a chunk out of your head. We would actually cut a chunk out of your head, and then we would have to divide them up and then put them back in. But the problem is, you're left with a pretty large scar, and a lot of our patients don't want to have a scar. And also for women who baldness in women is becoming it is really a major problem, but these patients are kind of hiding because they don't want the scar. So now these patients are coming out because we can do it without a scar now.
So what do you use now? It's completely different
completely different technology.
We'll get a look at this thing too.
Okay, this is just what the tip of our device would look like, because I couldn't bring the big device in today, but this is like a tiny, it's 1 millimeter around. That's actually smaller than a tip of a ballpoint pen. And what we do, this is connected to a kind of a computerized device. And what we'll do is we'll just punch little tiny hair follicles out.
Okay.
And
so you take it from like the back up here,
yeah.
So you're using that to punch up in this area.
Right, we're taking it from the donor area, which is always in the back, where we don't get typical pattern baldness, where the areas are very thick back here. We're punching out individual follicles randomly, only thinning it about 14%.
Okay.
Taking those little hair follicles, transplanting them back in. About 100% of them survive, which is better than the old style, which only about 70% survived. And our patients are doing amazing.
But a lot of people with the, especially men, the male pattern baldness, where it starts receding right here. If you transplant here, does it keep receding back here and all of a sudden you have a little island?
Well, that's a great question. And about 50% of patients who are hair transplant patients currently are people who've had it done before. So yes, we explain it and our patients understand. They get a treatment plan that they would understand over time, that if things continue to lose, or if you lose more hair over time, then you may have to come back to do another procedure.
Ron, what about you? What was, did it hurt? How long did it take for you to get back to normal?
I've had a few different procedures. I've had the old strip method like Dr. Basson was just speaking about, and I've had the new technology with the NeoGraft. The NeoGraft, it's a walk in the park. You're back pretty much the next day.
But don't people say, wait a second, man, you didn't have hair the last time I saw you. Do you get much of that?
No, because it takes a long time to grow in. It's not like you walk out of there, boom, you have a full head of hair like a chia pet. It's not like that. It grows very slowly. By the 3rd month, the little hairs start to break the surface. 6 or 7 months, you start to get happy. 11, 12 months goes by,
and
you're
it's
done.
there. Wow,
forever.
This is really interesting stuff too. And again, Dr. Basson, your website in case people want to check it out.
Well, if anybody wants to check out the whole NeoGraft and what we're doing, I recommend they go to OrlandoHairMD.com.
All right, we'll put it up on our website as well. Ron Doria, thanks, man. Good to see you. Dr. Basson, always a pleasure. Thanks for coming in today.